Good morning, everybody, and welcome to another episode of Coffee and Tea with AARP Connecticut. This is our bi-weekly conversation in which AARP staff and volunteers talk to Connecticut decision makers about policies and programs that are of interest to older residents. My name is John Erlingheuser, and I'm the Senior Director of Advocacy and Community Outreach here at AARP in Connecticut. And I'm very pleased to be joined today by one of our great AARP Connecticut volunteers, Mr. Tim Ryan. Tim, thanks for being with us today. And why don't you tell a little bit about yourself to the folks watching us this morning, your background, what you do for AARP, and anything you think that might be important.
Sure. I've been volunteering now for AARP for about 7 or 8 years. I love the advocacy work, love helping the MyCT program get up and running. It was great. My background, I'm a CPA with an MBA in finance, and I'm happy to be here today.
Awesome, Tim. And Tim is just kind of representative of all of the many great AARP volunteers we have across the state that do not only advocacy, but so many other things for our members and the public in general. So it's also my pleasure to welcome today Sean Scanlon. Sean is the Comptroller of the state of Connecticut. And Comptroller Scanlon, before we talk a little bit about the Office of State Comptroller, why don't you tell us a little bit about your background, maybe what are the positions you've held in government or anything that you think would be important for our viewers to know about you in or outside of government?
Well, again, hi, John, and hi, Tim. Thank you for having me on. It's always great to be here at Coffee and Tea with AARP. And, here's my background. I grew up in Guilford. My dad was a police officer. My mom was a stay-at-home mom. My folks split up when I was really young, and I was then mostly raised by a single mom. And I decided to get involved in politics at a relatively young age because I saw my mom struggle with healthcare and her lack of access to it. She almost never had health insurance when I was growing up. She would always pay cash at the doctor when everyone else was using a card. And so I ran for the State House when I was 27 to represent my hometown. And most people thought that I had no chance of winning, but I won. I spent 8 years in the legislature. I got the chance to chair the insurance committee and work on healthcare policy for 4 years. And then in my last 2 years in the legislature, I chaired the finance committee, which is the tax side of the state budget. During those few years, both working in healthcare policy and on our budget, I worked very closely with Kevin Lembo, who was the state comptroller at the time, because the comptroller's office actually does both those things. They're both the chief financial officer and chief fiscal watchdog of the state, but also the person who runs the largest insurance plan in Connecticut. I have 300,000 people who get their health insurance through our office. And so when Kevin actually resigned from this office due to a health concern and left this job, there was a lot of people who encouraged me to take a look at running for it because I had had that experience. And so I ran in 2022. I'm honored to have been elected and to be sort of halfway through my first term right now, and just excited every day to try to keep working on the things that I ran for office for in the first place, like making our healthcare system better, something I've been very proud to partner very closely with AARP on, but also things like retirement security, something that I'm now seeing firsthand is so important because that same mom that raised me is now still working in her mid-70s because she can't afford to retire. And so these are stories that are familiar to a lot of people listening because they're the stories that are familiar to a lot of Americans. And I'm just really excited every day to be getting to work, trying to make Connecticut more affordable, whether it's for health insurance, retirement, or just living. And I'm proud to be doing that with AARP.
Awesome. And I know you touched a little bit about your office, the Office of Comptroller, but Tim, why don't you take our next question and see if we can dive in a little?
Yeah. There's a lot of people that probably get confused on what your office does versus, say, the treasurer's office. Can you just be a little closer in terms of, how does your Office of Comptroller, how does it impact the residents of Connecticut?
Yeah, so as I said, I am the chief financial officer and the chief fiscal watchdog. What does that mean? Well, the treasurer is basically, the best way to think about it is the treasurer is all the money coming in and I'm all the money going out. And so I pay all the state's bills. I pay all the employees every few weeks. I pay all the retirees. I negotiate all their benefits. We do all of the auditing functions of the money that we're spending as a state going out to make sure that every taxpayer dollar is being used wisely. And so that's the easiest way I can sort of break down the difference between myself and the treasurer. We've got 6 divisions here in our office that work on all the things I just talked about, whether it's the payroll department or the auditing department or the financial services division, sort of doing some of that work. But at the end of the day, somebody's been doing this job since colonial times. The challenge that I am trying to bring to it as the youngest person ever to have this job is to try to make what I do accessible to the public, because I think when people understand what their government is doing with their taxpayer dollars, that's a better thing for society at large. And people can then be better citizens engaging their government because they've got these tools. So, for example, we run what's called Open Connecticut. You can go and look at what everybody in Connecticut makes. You can look at what we spend on every single program, all through a website called Open Connecticut. We've made our government as transparent as possible. And so whether it's through transparency or just explaining the work that I do, which is often very complicated and wonky, I'm just trying to make the Comptroller's office a little bit more successful. We've got a lot more work to do that. But I hope in my first 2 years, I've tried to explain what we do a little bit better than folks that have done that in the past.
That's really great. I'm Comptroller Scanlon, and I know in a little while we've mentioned a couple of times about MyCTSavings, and I know we're going to touch upon that. In fact, Tim will ask you about that. But can you really tell our viewers your thoughts about kind of the importance of Social Security when it comes to retirement security? I know your office isn't directly related to that, but when it comes to having a balanced retirement savings, that is one of the key components of it, and it's something that AARP is working on at the federal level, and you certainly have some experience with the federal government, so maybe you could talk to us a little bit about what your thoughts are there.
Well, first of all, let me just say very clearly, Social Security is one of the most important programs in our country. And if we don't do something in the next 10 years, we are going to have a significant problem. But what we know and what your listeners know, and I know firsthand now because of my mom, is that while that Social Security is a lifeline and a safety net for Americans, it is not enough to retire on. And so we have to keep it the way it is to make sure that that is there for folks going forward and that they don't have cuts to that system. And I will advocate for that until I'm blue in the face, even if it means having to go to Washington to testify with you. Just because I believe in Social Security and the promise that was made. But I also know that that promise is not enough to live on, because as costs go up and people on fixed incomes have to deal with more expenses, they need more. Now, that's why I'm spending so much of my time on retirement security as comptroller. I run a program called MyCTSavings. AARP and I have been in the trenches fighting to expand this thing and make sure folks know that it's out there. What it is very simple. Half of the workers in Connecticut right now don't get offered a retirement plan at their job. Most of the time, it's not because the employer doesn't want to offer it. It's because they can't afford to offer it. And so what MyCTSavings does is it allows the employers of Connecticut to offer a retirement plan to their employees at no charge to the employer. And so the employee pays some modest fees for the investments, but it doesn't cost the business anything. When I got elected, there was about 700 companies that were enrolled in this. I have visited probably a third of the downtowns in Connecticut, going business to business, handing out flyers, talking to mayors, talking to Chamber of Commerce presidents. And we actually right now have over 6,700 companies that have signed up. So 6,000 companies have been added during my term, and I'm very proud of that. But again, it comes back to my lived experience of my mom. I think that everyone should be able to retire with dignity and with security after a career of working and raising their kids and playing by the rules and doing everything that we have always been told that you have to do here in America. And we got to protect Social Security so that that's there for them. But we have to do a better job of educating my generation and the generation behind me about the importance of financial literacy and saving for retirement, because who knows, where your life is going to take you. But what we do know is that the more you save now and the earlier you start, the better off and more comfortable you will be towards the end of your life. And I think that that's why I spend a lot of time on this, because I see firsthand what happens when you don't.
And, Tim, one of our great volunteers is, as I said, near and dear to your heart. Tim, why don't you?
Yeah, I was the volunteer lead, or still am the volunteer lead for the retirement security at AARP. I've been doing it for a number of years now, getting the word out. And I just wanted to say, I run into your staff at several Chamber of Commerce events down here in Bridgeport, Shelton, one in Fairfield. So I know your staff is out there getting the word out, and everywhere you go, it seems to be received very positive. So congratulations.
Awesome.
Thanks, Tim.
So, Comptroller Scanlon, where would people go to get more information? What would a business need to do? How could they go about applying for this? What about interested employees? What's the process in more depth, and where would they get information about it?
We've made it so simple. We actually just redesigned our website too, and it's MyCTSavings.com. All you need to do as a business is log on. It takes less than 10 minutes for you to register your business. All you have to do is simply tell us who your employees are. We make this Roth IRA account for them, and then they choose whether or not they want to save or not. That's the classic thing that we believe in. We're going to give you the tools you need to succeed, and then it's up to you. It's America, right? You make the choice. If you want to do it, you do it. If you don't want to do it, you don't. 85% of the people we create these accounts for decide to save. Which is, for me, a huge validation of this program, is that when you give people the tools, they want them. They want to save. Guys, I've heard incredible stories across the state from people who are first-generation Americans who go home and their parents start crying when they tell them that they have a savings account because those two individuals have never had a bank account. We've heard of businesses that were paying an arm and a leg for 401k fees, then gave every one of their employees a raise with the money that they saved, not having that heavy fee 401k plan. So I hear great stories about this going forward. And as I said, we've had a lot of growth in the first year and a half that I've been in this job, but there are still many, many more businesses that are available. And the problem, guys, as you know, is that these businesses are really busy. It's really hard to run a small business. You got a million different things coming at you every day. And yeah, we send out letters that say MyCTSavings, but they stack up next to your electric bill and your health insurance bill and your tax bill and all these other things. And so I am proactively trying to get out there as much as I can to meet people where they are, tell them about this, and get them to sign up. We are sending out a wave of letters to all the new eligible businesses to spread the word about that for them. But if you're listening and you own a business, if you're listening and your son or daughter owns a business, or if you love going to the pizza place down the street, go in, ask them if they've ever heard about MyCTSavings, tell them to check out the website, and remind them that this is free. That's the most important thing that I can get to folks. There's a lot of skepticism about government these days. There's a lot of people who say, can government still solve problems, or what's the catch? Sounds too good to be true. This is truly an example where we have come together to do something that I believe will help every single business in the state. If they already offer a 401k or a retirement plan, that's great. I'm proud of them. But for those that have always wanted to do it but can never afford it, MyCTSavings is a great tool for you, and it will help you help your employees. But we just need your help to do that.
And I just want to add it to what Tim has said. You and your staff have been just outstanding in terms of pressing the flesh and getting the word out about this program. And I have to commend you with the 85% employee participation rate, which is the highest in the country of the states that actually have a program similar to MyCTSavings. So the education outreach that you're doing is really, really tremendous. So, and this isn't the only thing we work on with your office. And Tim, why don't you talk a little bit about some of the other things that?
Yes. So yeah, one of the other areas that's been a focus for us at AARP Advocacy is prescription drug affordability. And now I know that we worked with you when you were a legislator on this topic, and even now that you're a comptroller, we've been working with you. So what are you currently doing, I guess, with regards to prescription drug affordability?
Well, this is very important to me because we're experiencing, as I think everybody watching this knows, a crisis of drug affordability in this country. We pay more for drugs than just about everywhere else in the industrialized world. And that is not an accident. It's because almost everywhere else in the country negotiates for drug prices, except here in the United States of America. President Biden, thanks to the Inflation Reduction Act, we are about to start negotiating for the price of 10 very commonly utilized drugs on Medicare starting next year, which I think will be a game changer in terms of making drug prices more affordable in America. when you combine that with another part of the Inflation Reduction Act that most people don't know about, which is that $2,000 out-of-pocket cost cap for prescription drug costs for seniors on Medicare, those two things are going to be a big deal. But for a long time here in the United States, we have seen the price of drugs go up and up and up, and people simply can't afford them anymore. 1 in 5 people in our state has reported saying that they do not take a prescription that they are supposed to take because they can't afford to fill it. And I just find that to be so unacceptable. So, Tim, to your point, I have spent a lot of time working on this, both as a legislator and now as comptroller. And what we're doing right now, similar to MyCTSavings, is to use the state's leverage to help regular people. And so in 2023, the governor and I introduced a bill to allow Connecticut to go into what's called the AARP Coalition. That's ARRAYRX, ARRAYRX, which is a group of states that are working to offer drug discount cards to their residents based on the bulk purchasing that we do as a state. The bill passed in 2023, and on October 1st of last year, we launched this card. We've had 20,000 people sign up for it so far, and the average savings that somebody has using this card is about $200. But we still have so many more people that could take advantage of this. And so I'm out there in the state trying to promote the fact that you can go to arrayrxcard.com right now, download that card for free, and use it at 98% of the pharmacies in our state on every single FDA-approved drug. And so if you're somebody who has struggled with the cost of drugs, check out that card. You cannot use both the card and your insurance card at the same time. But every pharmacist in Connecticut is aware of what this is now. We've been doing a lot of trainings, and we are asking people to go into the pharmacy, use both their ARRAYRX card and their insurance card, figure out which one is cheaper, and then use that. One other thing I'd like to mention that I think is a great tool for this and your members to use is that if you go to that website, you can actually look up what your specific drug will cost at specific pharmacies. So if you're like me and you live in a town that's got 3 or 4 pharmacies, you can search that drug and go to the one that has the cheapest price. If you're not great with computers, ask a neighbor or a friend or a grandson. You can also call our office, and we're happy to help you with that as well. But use this tool as a way to save, and I encourage everyone in Connecticut to do it. And importantly, it's not just for seniors, it's for everybody in Connecticut. So spread the word, tell your friends and loved ones, and hopefully with more people joining this, we'll be able to lower the cost even more for folks here in Connecticut.
That's really great. And we really appreciate all the work, as Tim has said. And, we worked on prescription drug efforts with you as a legislator, and we're so pleased to have partnered with you in getting this ARRAYRX legislation passed. And we'd like to make sure we do as much as we can to get that word out there. So we have a little bit of time left. Is there anything else that you would like to cover and make our audience aware of that you think might be of interest?
Yeah, well, what I would say is, we're in a very divided political time, right? And tensions are really high in this country. And I hope that we're going to do what we can to lower them. What I would say is this, though, is there's a tendency amongst a lot of people I've talked to just tune out politics, to give up on the idea that government can solve problems. And why should I even engage? But I truly believe that government still can solve problems, and we still can solve them on a bipartisan basis too. But we have to roll up our sleeves and we have to work on things. And we have the ability to do that. And we have good ideas in government, but some of our best ideas come from hearing from our constituents and from the people that we serve. And the same is true, I know, for AARP, right? It's listening to our members or our constituents and getting to work and trying to do something about these problems that we face. And so whether it's trying to address what's going to happen if Social Security doesn't get a more sustainable funding plan for the future, or prescription drugs, or retirement, these are things we can't just kick the can on. We've got to find solutions now. And I am so excited to be able to have a job where I can do that. But I would love to hear from people. So if you're watching this and you have ideas or you've got thoughts, tell John and Tim about them. Reach out to my office, call your state rep and your state senator, and let them know what you want to see done. Believe that we still can get things done, because when you believe that and you hold your elected officials accountable to that mentality, stuff does get done and we can tackle these problems. And even in times where it seems very dark and that, sort of hopeless about our ability as Americans to still work together, I still have optimism and idealism. And I hope that you will believe that too and help us help you by making our state a better place to live, work, retire, raise a family, all the things that all of us, of course, want to see for a better future.
Awesome. Tim, anything else before we wrap up?
Nope, that's it.
Well, I really do appreciate, Tim, you and all the AARP volunteers for all the work you do. And Comptroller Scanlon, thank you for being such a great partner and for all you're doing for the state of Connecticut, and particularly in the areas of healthcare and retirement security, two of the big important areas that AARP works on and does advocacy on. So we really appreciate having you. And I'd like to thank all of you for tuning in to another episode of Coffee and Tea with AARP Connecticut. Join us again in 2 weeks for another episode, and catch back episodes on demand right here on our Facebook page or on our YouTube page. And you could scan this QR code to become an e-advocate and help us advance policies important to the 50+ population in Connecticut, like prescription drug coverage and retirement security. So thank you all and have a great rest of your day.